We often think of fixing eyesight, glasses, contacts, surgery, as really modern. But that urge to see clearly, that's ancient.
Oh, absolutely.
And today we're going way back. We're diving into the Middle Ages, specifically looking at how they dealt with a major cause of sight loss, cataracts.
Exactly. Cataracts, right. That's the clouding of the eye's lens,
Hmm.
makes vision blurry, fuzzy, and yeah, can lead to total blindness.
And it wasn't just aging, like we often think of today.
No, I mean, age was a factor, sure, but also injuries, other conditions, and you have to imagine dealing with that back then without our tech. It was a huge, huge challenge.
It really is stark to think about. And to understand how they faced it, we need to picture the whole medical scene in the Middle Ages, so
Hmm.
roughly 5th to 15th centuries.
Hmm. Yeah, that's the time frame. And knowledge was, well, it was different, very much built on ancient Greek and Roman ideas, Hippocrates,
Ah,
Galen,
like the
but
classics.
also deeply, deeply mixed with religious beliefs and, frankly, a good bit of superstition, too.
It sounds like a real melting pot of ideas.
It was. You had this ancient wisdom, but seen through a strong religious filter. And that really shaped how they saw illness, healing, everything.
And who was actually doing the medicine?
Well, it was varied. You had monks in monasteries doing some care, then university-trained physicians, they were more about theory, reading the old texts.
The academics.
Kind of, yeah. And then you had the barber surgeons. They were the ones doing the hands-on stuff, the
Okay,
procedures.
for barber surgeons. And surgery itself didn't have the same prestige back then, did it?
No, definitely not. Theoretical medicine was seen as much more elevated. Surgery was manual labor almost, lower status.
Okay. So our mission for this deep dive is to really get into how medieval folks handled cataract blindness. What were the techniques, these basic techniques, and how did different cultures, surprisingly, play a role?
It's a fascinating glimpse, really. Something we often fix relatively easily now was completely life-altering then, and the attempts to fix it were, well, incredibly risky.
And cataracts weren't the only eye issue, I assume.
Oh no, not at all. Glaucoma, other impairments, infections, eye problems were pretty common.
And treatment options were limited.
Very limited. You're looking at herbal remedies, lots of prayer, maybe some charms or rituals based on superstition, wishful thinking, perhaps.
But, and this is where it gets really interesting, you mentioned, actual surgery for cataracts did start to emerge
Hmm.
later in the Middle Ages.
Yes, it did. And it's kind of remarkable that cataract surgery was one of the few procedures that really sort of took hold back then.
Why do you think that was?
Well, think about how devastating blindness was. Losing your sight meant losing independence, livelihood, everything. So the potential reward, even with huge risks, made people more willing to try something drastic. It was often a last resort.
Right, desperate measure.
Mm.
Okay, so let's unpack the main technique. You mentioned it earlier, couching.
Couching, yes, that was the primary method. It sounds sort of gentle, but, well, it wasn't.
Where did it come from?
Its roots actually go way back, ancient India, maybe 5th century BCE, but it really saw a revival and was refined and practiced quite a bit in the Islamic world during the Middle Ages.
Okay, Islamic medicine was key here.
Yeah.
But first, what was couching? Can you describe the actual procedure?
Sure. The basic idea, and it is quite basic, was to physically move the cloudy lens, get it out of the line of sight.
How?
They'd use a sharp instrument. Think of a thick needle, maybe a specially designed small knife or probe. They'd insert this into the eye.
Into the eye, wow.
Yeah. And use it to push the cataract, that clouded lens, down and back, out of the pupil, into the lower part of the eye cavity, the vitreous humor.
Just push it out of the way.
Essentially, yes.
Yeah.
The hope was it would just stay down there, maybe get absorbed by the body eventually.
Okay, walk us through the steps. How would it happen?
All right. So the patient would usually be sitting up, maybe lying down. They needed to be held still, obviously.
I bet.
For numbing, well, very basic options. Maybe some wine to dull the senses, perhaps pressing on the eye, or some herbal concoctions applied. Nothing like modern anesthesia.
Right, primitive.
Very. Then the surgeon inserts the sharp tool, usually going in through the side, through the white part, the sclera, or sometimes even through the cornea, that clear front part.
Cool.
Then comes the tricky part, maneuvering that instrument inside the eye to engage the lens and carefully, deliberately push it downwards, dislodging it from its normal position.
That sounds incredibly delicate and risky.
It was, immensely so. Once the lens was pushed down, hopefully out of the pupil's view, they'd withdraw the instrument and bandage the eye. then hope for the best, essentially. Hope it healed without major
You
complications.
can't help but just shudder hearing that, and the risks must have been astronomical.
Oh, absolutely huge. Infection was probably the biggest killer or cause of blindness post-surgery. Remember, no concept of germs, no antibiotics.
Right.
Then there's damaging the eye itself during the procedure, poking the retina, causing massive inflammation, glaucoma, retinal detachment, even perforating the eyeball completely.
Wait, what?
Blindness was a very, very common outcome.
So the success rate wasn't exactly stellar.
By our standards, terrible. Even by theirs, it was highly uncertain. It wasn't about restoring clear, sharp vision like modern surgery.
So what was the goal then, if not clear vision?
It was more about getting some light perception back. If you were completely blind, being able to maybe distinguish light from dark or see large shapes, that was considered a success. It could make a difference between total dependence and a little bit of function.
So it was really a measure of last resort.
Absolutely. Only attempted when vision was already extremely poor or gone. The potential gain had to outweigh those massive risks.
This really brings us back to the role of Islamic medicine you mentioned earlier. It sounds like they were essential to this practice.
They really were pivotal. During Europe's early Middle Ages, a lot of the ancient Greek and Roman medical knowledge was somewhat lost or less accessible in the West. Islamic scholars, however, were actively preserving these texts, translating them into Arabic.
So they were the keepers of that knowledge.
Keepers and expanders.
Yeah.
They didn't just copy, they critiqued, experimented, added their own observations. Medicine, including surgery and ophthalmology, flourished in the Islamic world during this time.
And they were particularly skilled surgeons.
Many were, yes. Surgery held a more respected position in Islamic medicine compared to contemporary Europe sometimes. And ophthalmology, the study and treatment of the eye, was a field where they made really significant contributions.
Can you give us some names, key figures?
Sure. There's Al-Razi, known in the West as Rhazes, a Persian physician, a polymath really, who wrote incredibly comprehensive medical encyclopedias that included detailed sections on eye diseases and their treatment. He connected the ancient knowledge with current practice. Then you have Al-Majusi, or Haliabas. He also wrote a major medical text, and he specifically described surgical procedures, including, yes, the couching technique for cataracts.
So they were documenting this stuff.
Exactly. And another crucial figure, though maybe less directly surgical, is Ibn al-Haytham, or Al-Hazen. He was a true pioneer in optics.
Optics. How does that connect?
Well, he meticulously studied the anatomy of the eye, how light works, how vision actually happens. His work on optics and the physics of light fundamentally changed the understanding of sight. It laid the scientific groundwork for later developments in ophthalmology, even if he wasn't the surgeon himself.
That makes sense. You need to understand how it works before you can effectively try to fix it.
Precisely. His work was foundational.
So while all this innovation and documentation is happening in the Islamic world, what's the picture in Europe? You said knowledge was more limited initially.
It was in the earlier medieval period, but things started to shift. A big factor was, perhaps surprisingly, the Crusades.
The Crusades. How did they play into medical knowledge transfer? Seems unlikely.
Well, it wasn't the primary goal, obviously, but the Crusades led to much more prolonged and intense contact between Europeans and the Islamic cultures of the Middle East. People traveled, interacted, observed, and soldiers, nobles, scholars brought back knowledge, objects, ideas,
Including medical ideas.
including medical texts and practices. And crucially, around the 11th and 12th centuries, scholars began translating major Arabic medical works into Latin. Figures like Constantine the African working in Italy were hugely important. They made texts by Al-Razi, Al-Majusi, and others available to a European audience.
So that's how couching started to spread in Europe, through these translations.
That was a major route, yes. So by the 13th century or so, you start seeing couching being performed more often in Europe, but it was still viewed with extreme caution. Very dangerous. Many university-trained physicians were reluctant to touch surgery, especially eye surgery.
Which brings us back to the social hierarchy you mentioned. If the top physicians weren't keen, who was doing it?
This is where the distinction really matters. You had the physicians, learned, theoretical, university-based, and then you had the surgeons, the practical, hands-on group. And surgeons generally had lower social standing.
The barber surgeons fit in there.
Exactly. They're often the most common surgical practitioners, especially outside of major cities or universities. They'd pull teeth, let blood, treat wounds, set bones, and some would also attempt procedures like couching.
But their training wasn't formal university stuff.
No, usually it was through apprenticeship, learning by doing, passed down from master to apprentice. Practical skill, yes, but maybe less of the theoretical underpinning or the broader medical knowledge that the physicians had or were supposed to have. And their social status reflected that.
It's such a different landscape. And what about the church? How did religious views affect this kind of surgery?
Immensely influential, especially in Europe. The church was central to medieval life and thought. And there was sometimes suspicion around surgery, interfering with the body, God's creation, particularly something as sensitive and vital as the eye. It wasn't universally condemned, but there were definitely moral and theological concerns.
So it wasn't just a medical calculation of risk versus reward.
Not solely, no. People's decisions and surgeons' willingness to operate were shaped by these religious beliefs. Plus, medicine back then was deeply tangled up with folk beliefs, superstitions.
Right, you mentioned charms earlier.
Exactly. So, alongside any attempt at couching, you'd likely find prayers being said, maybe specific saints invoked, perhaps amulets worn or rituals performed. Healing was seen as partly physical, partly spiritual, or even magical.
It sounds like progress in improving eye surgery must have been incredibly slow during this whole period.
Very, very slow. For centuries after its introduction in Europe, couching remained the main approach for cataracts, and it stayed incredibly risky and often failed. Techniques didn't advance much during the later Middle Ages.
But the knowledge wasn't completely lost.
No, and that's crucial. Thanks in large part to the Islamic scholars who preserved, translated, and built upon the ancient texts, the core knowledge of ophthalmology survived. That continuity was vital.
And eventually, that foundation allowed for real improvements.
Yes. When you get into the Renaissance, starting around the 16th century, things begin to change more rapidly. You see better understanding of anatomy. Think of Vesalius' improved surgical tools and techniques start to emerge slowly. It's a long road, but it leads towards the much safer and more effective cataract surgeries we benefit from today.
So, looking back at medieval couching, it was crude, dangerous, often unsuccessful, but still important.
Absolutely. Despite all its flaws, it represents one of the earliest attempts at surgical intervention for a specific debilitating condition. It was a bold, if often tragic, step, and it laid a groundwork, however shaky, that later generations could build upon.
And the legacy isn't just the procedure itself, is it?
Not at all. It's also about the resilience of medical knowledge, the crucial role of cross-cultural exchange, especially the contributions from the Islamic world that kept learning alive and advanced it. Modern ophthalmology owes a real debt to those medieval physicians and scholars.
It really is powerful to reflect on. When you think about the sheer risk involved, the low chance of success, what is that intense desire to try something, anything? Tell us about how deeply humans value sight. The lengths people would go to, even back then, to regain even a little bit of vision is quite profound, isn't it? Makes you appreciate what we have now and the long journey to get here.